Paricalcitol versus calcitriol. Both are referred to as, quote, active vitamin D. This is a generic term which can be confusing in both scientific and medical literature. It's important to distinguish the VDR agonists as distinct chemical entities. The term active vitamin D is ambiguous because of different epistemologies being used by scientists, clinicians, and patients. We'll illustrate that in this slide. How are they different, paricalcitol and calcitriol? Health practitioners will recognize paricalcitol as its brand name, Zemplar. Its abbreviated chemical structure name is 19-nor 125-dihydroxyvitamin D2. Even this elongated name is a shortened abbreviation of the full IUPAC name for this chemical compound. 19-nor means that there is a methylene group that is missing from the backbone molecule, in this case vitamin D2. And yet this molecule, which is based on a vitamin D2 backbone, is hydroxylated at the 1 and 25 carbon positions, similar to calcitriol, the endogenous kidney metabolite of vitamin D3. And so calcitriol is referred to as active vitamin D3, whereas paricalcitol can be referred to as active vitamin D2. As I mentioned, 19-nor indicates that a methylene group has been removed from the 19 carbon position. In a subsequent YouTube, we will go into the nomenclature, the IUPAC nomenclature for these chemical bonds. On the right, you see different abbreviations for calcitriol. 125 vitamin D3, which can be abbreviated as 125D3, or simply 125D. Let us now shift the narrative to paricalcitol, 125 vitamin D2. Paricalcitol is a selective vitamin D receptor activator, which offers significant immune modulating and anti-inflammatory benefits, particularly for chronic kidney disease patients, CKD patients. Paricalcitol reduces chronic inflammation by suppressing pro-inflammatory cytokines, inhibiting nuclear factor kappa B signaling, that is a master pro-inflammatory transcription factor upstream of cytokines. So by inhibiting nuclear factor kappa B signaling, suppresses the downstream production of cytokines. In addition, paricalcitol reduces oxidative stress, particularly by activating vitamin D receptors, upregulating NRF2, GPX4. And GPX4, as we have stressed on this channel, is a key enzyme to chemically reduce reactive oxygen species as well as peroxidated lipids, the latter being upstream drivers of a programmed cell death known as ferroptosis. So the anti-inflammatory antioxidant actions of paricalcitol help mitigate cardiovascular damage and renal fibrosis. Here are two references quite a number of years apart. The bottom is references from 2008. Paricalcitol inhibits renal inflammation by promoting vitamin D receptor-mediated sequestration of nuclear factor kappa B signaling. Above that is a review in 2021. Research progress in the pharmacological actions of the multiple effects and selectivity of the vitamin D analog paricalcitol, a narrative review. On the right is a vertical information vector the vitamin D receptor plus its agonist, a molecule that activates it, Paricalcitol 125 vitamin D2, produces a set of actions: anti-inflammatory actions, antioxidative actions, as well as antimicrobial actions. And so these benefits are well known to nephrologists, physicians who treat chronic kidney disease patients. And AI provides this summary of the benefits of Paricalcitol. Anti-inflammatory effects. Paricalcitol reduces the expression of inflammatory cytokines and inhibits the nuclear factor kappa B signaling pathway, which is a key driver of chronic inflammation. Reduced oxidative stress. Paricalcitol acts to decrease oxidative stress, which contributes to cardiovascular damage in hemodialysis patients. Modulation of immune cells. Paricalcitol has potential to modulate immune function, including impacting antigen-specific T cell responses and showing a tendency to improve delayed hypersensitivity reactions. Reduced renal inflammation. Studies indicate that Paricalcitol inhibits renal inflammation by sequestering nuclear factor kappa B, reducing inflammation-related damage in the kidneys. Cardiovascular protection. By controlling inflammation and reducing vascular calcification, Paricalcitol protects endothelial cells and reduces the risk of atherosclerosis. On the lower right, you see the diagram of a glomerulus. This is the filtration apparatus for a single nephron. The nephron is the tissue unit of the kidney. The first part of the nephron is the glomerulus, which is interconnected to a bolus of capillaries, a fenestrated network of capillaries. Arterial blood is brought into the glomerulus, where it is filtered through cell layers, including a membrane which connects the endothelium to internal components of the glomerulus. And then blood is taken out of the glomerulus. As the low molecular weight components in the serum are filtered through the glomerulus, they are emptied into Bowman's capsule, which empties into the first part of the nephron called the proximal tubule. This brief discussion of the filtration mechanics and its connection to the tissue structure of the nephron are useful for the upcoming slides, where we will be discussing the impact of COVID and long COVID on the filtration rate of the kidney. Before leaving this slide, it is important to reemphasize that Paricalcitol protects endothelial cells. In doing so, Paricalcitol is a vasculoprotective agent. It protects the heart, blood vessels from inflammatory damage, oxidative damage. In addition, by protecting endothelial cells, it also protects other organs, the lungs, the kidneys, the brain. So with this ability of Paricalcitol to control inflammation and oxidative stress, it's important to ask the following question: why is Paricalcitol not being used for long COVID? The short answer is it already is being used for the treatment of long COVID in certain patient populations. Those patients who have chronic kidney disease. Certainly, Paricalcitol was being used in chronic kidney disease patients and hemodialysis patients during the COVID pandemic. And it was demonstrated in one study that Paricalcitol provided a substantial survival benefit to hemodialysis patients who were taking Paricalcitol prior and during their COVID infection. Paricalcitol is also being used to treat long COVID patients who have new onset CKD. And so in these patient cohorts, there is already existing information about the immune benefits of this vitamin D receptor agonist.